Hey, it's Dr. Thornell, and I want to share with you an important exercise today. It's a little bit of stretching, a little bit of strengthening, and more importantly, a way for your brain to really connect with the psoas muscles, which are, I'm sure I've spoken to many of you about psoas muscles before. When psoas muscles get tight or dysfunctional, they lead to a lot of lower back problems and pain. And if you're unfamiliar with the psoas, here's what your psoas muscle looks like. It actually starts on the front of your thigh, comes up on the inside of your pelvis, and then begins attaching to your lower back, all the way up into underneath your rib cage. And the exercise that I'm going to show you, again, it's a little bit of a stretch, a little bit of a strengthen, but it helps your brain to understand how to really control that muscle. And in reality, in your everyday life, it's mainly there's some danger in lack of flexibility, there's some danger in weakness, but it's a lack of your brain to be able to control those muscles properly that leave you vulnerable to injury. So the exercise I'm going to show you is pretty simple, and what you want to do is you'll just find yourself, you'll see in a second here, I've got two books that I'm going to use to stand on. You can use the edge of a stair, you can use all sorts of different things, a little stool, but you need about 6 inches of space for one foot to stand on and the other foot to drop below that space, as you'll see here in a second. And what you want to do is just start out with maybe 5 on either side and work up to doing 10 or 15 once or twice a day. And the exercise looks like this. You are simply going to stand on, again, the edge of a step, a stool, a couple of books like I have. You'll want something to be able to balance yourself with, so grab onto a handrail or something like that. We are going to lock out the knee that's on the stair or the books, so that leg is going to stay straight the whole time. We're then going to allow the foot that is not touching anything to go down as far as we can get it by stretching your pelvis down on that side. Far as we can go, and then we want to bring it up as high as we can and really feel the motion as you're going down. Feel that psoas lengthen, feel it then contract to bring the pelvis back up, but all the while keeping that knee totally straight. We don't want any bend in that knee or we've lost the point of the exercise. So all the way down as far as we can get it, all the way up, contracting that psoas, and just simply working back and forth. Once we've done our 5, 10, 15, then we switch and do the other leg. So that's one for you that, yeah, will give you a little bit more flexibility. It will give you some strength in those psoas muscles, but it's going to give you as much control. It's going to help your brain understand how to target those muscles for movement so you're much less vulnerable to injury in your everyday life.